Question number 1. Which acid base imbalance is caused by prolonged vomiting? The correct option is B. Metabolic alkalosis. Question number 2. What is the main site of absorption of vitamin B12? The correct option is A. Ileum. Question number 3. What is the recommended gap between two doses of DPT vaccine? The correct option is C. 4 weeks. Question number 4. What is the most common cause of antepartum hemorrhage? The correct option is B. Placenta previa. Question number 5. Which of the following is a loop diuretics? The correct option is A. Furosemide. Question number 6. Which antibiotics is safe during pregnancy? The correct option is A. Penicillin. Question number 7. Which condition is cause a bounding pulse? The correct option is C. Hypervolemia. Question number 8. Which assessment tool is used for fall risk in hospitalized patient? The correct option is B. Morse fall scale. Question number 9. Which type of shock is characterized by bradycardia and warm skin? The correct option is C. Neurogenic shock. Question number 10. What is the daily requirement of iodine for a pregnant woman? The correct option is C. 250 microgram. Question number 11. Which term describes the inability to recognize familiar object? The correct option is D. Agnosia. Question number 12. What is the normal range of amniotic fluid index? The correct option is C. 8 to 18 centimeter. Question number 13. Which fetal heart rate pattern suggests umbilical cord compression? The correct option is A. Variable deceleration. Question number 14. Which insulin has the longest duration of action? The correct option is C. Insulin glargine. Question number 15. Who is known as the father of modern nursing? The correct option is D. Florence Nightingale. Question number 16. Which vaccine is contradicted in pregnancy? The correct option is A. MMR vaccine. Question number 17. What is the normal range for urine specific gravity? The correct option is B. 1.010 1.030. The correct option is question number 18. Which electrolyte is responsible for narrow impulse transmission? Correct option is A. Sodium. Question number 19. What is the daily iron requirement for a pregnant woman? The correct option is B. 27 milligram. Question number 20. Which is the best site for deep intramuscular injection in adults? The correct option is C. Ventricular. Question number 21. What is the most common site of myocardial infarction? The correct option is B. Left ventricle. Question number 22. Which disease is known as brick, brickbone fever? The correct option is A. Dengue fever. Question number 23. Which hormone is responsible for uterine contractions during labor? The correct option is C. Oxytocin. Question number 24. What is the normal range of fetal heart rate? The correct option is B. 110 to 160 beats per minute. Question number 25. Which law in India regulates the use of medical termination of pregnancy? The correct option is B. MPT Act 1971. Question number 26. What is the first sign of hypothalamic shock? The correct option is D. Tricardia. Question number 27. Which vitamin is required for calcium absorption? The correct option is B. Vitamin D. Question number 28. Which gas is used for general anesthesia induction? The correct option is A. Nitrous oxide. Question number 29. What is the recommended depth of chest compression for an adult? The correct option is C. 5 cm. Question number 30. What is the incubation period of measles? The correct option is B. 7 to 14 days. Question number 31. Which of the following is a definitive sign of death? The correct option is C. Rigor mortis. Question number 32. Which part of the brain controls breathing? The correct option is D. Medulla oblongata.